Hello, everybody. Today, this is the second episode of Inspiring Journeys at Miyara. So today's topic is a mom-related topic. As all moms would agree with me, our pregnant look doesn't go away just after we deliver the child. So this is what we are going to talk about today. For this, we have Dr. Aishwarya Sridharan, who's a life science researcher, science communicator, and a pre and postnatal enthusiast. Welcome, Aishwarya. So, we will be talking about this condition called diastasis recti. Can you please elaborate on this?
Hello, hi. It's nice to be here. I'm very excited to talk about this condition because not many people know about this. And I was when I first learned about it, I was just astounded by the fact that many of us are kept unaware about this condition, and that really made me um, very sad because this fact needs to be communicated to all women who has undergone pregnancy, and this is an excellent platform to share this. And thanks again for giving me the opportunity.
We are really glad. Yeah. Can you just
So,
explain to us if it is, you had shared with us that this is just beyond just the looks. Can you just explain what that means?
so first, let me explain what is diastasis
Yeah.
recti. Diastasis recti is nothing but the six-pack muscle. So every human being has this core muscle that holds all the internal organs in place. However, during pregnancy, the muscles expand and they form a gap to accommodate the fetus. And this happens during the second and the third trimester. However, post the delivery of the child, the muscles seldom go back to its original place with the correct tension. And that's where this condition is called as hysterectomy. It is nothing but weak core muscles that have expanded, or is also called as a separation of the abdominal muscles.
Okay.
So there are different kinds of diastasis recti. So this is how the abdominal muscles are in a normal person, and sometimes the diastasis recti is in the middle or below the belly button or above the belly button or throughout. And this condition will differ between different mothers, right? So it is really important to understand what diastasis recti is, and also what kind of diastasis recti you have, so that you can actually try to figure out the correct way or exercises to help make this condition better.
Okay. So how did you go about finding about this one?
So as with all the moms, right? As you know, I have two kids, so and they are like 3 years apart. So after my first pregnancy, I was left with a small belly pouch, right,
Hmm.
the tummy, but I didn't pay much attention to it. And I conceived for my second within about like 2.5 years after my first delivery. And during my second pregnancy, I found that my belly was abnormally big, and then people used to ask me whether I was carrying twins and whether I was sure it was only one child inside. So when I consulted my gynae, I was very conscious about it, and then she just said that your core muscles are weak, and then you have to get it treated after your pregnancy. So that's about the information I got. And post pregnancy, even after like a couple of months, my pregnancy pouch didn't go back to normal, and people came to me and asked whether I was pregnant again, and how come or I haven't or if I have delivered yet, and things like that. Are you the I stayed on the 5 month pregnant look from then on. And the first thing is, like, of course, a look, right? I mean, you get very conscious when people come and ask you if you're pregnant all the time. And secondly, I started to have a lot of neck, shoulder issues and back pain issues. And then it was very recurrent. Wherein, like, every second day, I used to have headache that was associated with neck or shoulder strain. And it came to a point where I couldn't even lift my 1 year old daughter, because if I lift her, I would start to get headache. So, and then I tried to consult my gynae again, and then but she wasn't. I mean, she wasn't. Um, aware of any other thing, or even our doctors, they just gave me medicines for headache or body aches, and that's about it. So one day when I was going through different Facebook feeds in the mother support groups, some people mentioned about a condition, this condition called the diastasis recti. Then I started to read up more upon that, and then throughout through this journey, I found out a lot of information regarding that, and that's when I diagnosed that, yes, I did have this diastasis recti problem, and it is a condition that needs to be attended to immediately.
Oh, okay, so how do we get it diagnosed? If you don't, I mean, if you said that gynec didn't know much, so who should people go to?
So generally, this in other countries, this condition is usually diagnosed by the physiotherapist. So if you know a physiotherapist, you can go to them, and they should be aware of it. So you can Google and see whether your physiotherapist is aware and treating this condition before you can approach them. So I did approach one in the country where I am, and then they helped me to kind of measure it. But before that, there are some measurements that can be done at home as well, and it was a very similar thing which my physiotherapist did. So basically, what you have to do is you have to lie flat on the ground with your knees bent, and then keep your fingers like this, just above your belly button area,
Okay.
and then slowly you have to lift your head as if you're doing a crunch, but very slowly with the head supported by your hand. And once you start to move up, you can feel the gap between the between your fingers widen, and then
Okay.
at one point they'll start to, and as and when you go further up, you will feel the gap closing down. So
Okay.
you have to measure the gap at a position where it's actually comfortable for you, like coming up too much, and then you have to start measuring the gap with your fingers, and that is how much of the muscle separation is in your abdomen. And also you have to check how deep your fingers go inside your abdomen, and that is the depth of your diastasis recti. So
Okay.
when I measured the very first time, I was like 4 fingers wide and about 1.5 knuckles deep. That's like a severe condition of diastasis recti.
Okay. So once somebody realizes they have this condition, what should be done about this?
So there are different programs available by mom turned fitness experts. So they have designed a well structured program which follows an exercise regime, a diet regime that can be followed, and these exercises are the ones that are safe for diastasis recti, and also it helps to strengthen the core muscles. So if you just Google, programs for diastasis recti in, like, internet, or if you look into Facebook support groups, you will come up with a lot of such programs. And the key is, like, you have to choose one program and try to do it consistently. So this is not a miracle program, right? If you it doesn't mean that if you just do for, like, half an hour every day for a week and then you see a result. No, this condition has appeared because of 9 months of progressive separation of the muscles during your pregnancy. And if you had multiple pregnancies, it would have been even worse, right? So you should give the body at least bare minimum of 6 to 8 months for it to recover from it while doing the exercises. So some people with many with less severe diastasis recti have seen effects between 4 to 8 weeks of consistent exercises every day.
Hmm.
However, for severe conditions, you may also take even up to 6 or 8 months to get to see considerable effect. But what will be visible within the first few weeks of doing is that you can feel your core getting more tensed, your core muscles getting tensed. So you can also feel that the neck and shoulder pains or your back pain or even pelvic floor issues become better over time.
Okay. So what has been your personal experience, like in terms of the time frame? Uh, has the program been effective in your case?
And during the 3 months of the COVID lockdown, I used to do consistently every day. and I went from like 4 fingers to 3 fingers in about 3 months.
Okay.
So the
That's great.
consistency is the key for that. And then along with it, the posters, because posture is really important in maintaining or healing of the core muscles.
Okay.
And several of these programs also mention what is the correct way of standing, how you should do your day-to-day work so that you minimize the damage that you do for your core muscles. So we have to pay attention to those. And
Hmm.
then it's more of having a lifestyle change so that we can bring upon a speedy recovery to your core muscles. And along with it, they also mention some diet, and it's more of clean eating and other healthy diet eating, so that if there's any fat or anything else associated with your bulge also gets reduced. So at the end of the day, we have the correct core exercises, the correct posture the entire day, and the right diet and a healthy lifestyle diet, then you'll be able to address the problem in a more holistic approach.
Yeah. So there are a lot of advice being given out around like post pregnancy to tuck in your tummy, like having a belly wrap or something. Have you tried those? Did it work for you? Will it prevent in the long term this problem?
So first and foremost, right, just imagine like post your pregnancy, your muscles have become like a very loosened rubber band. And do you think that if you put the rubber band in a very tight container, will the rubber band have its elasticity restored? No, right? It's a very similar case over here. So your muscles have expanded beyond their ability to regain back their shape. And during this time, definitely the tummy wraps or the belly bells will help to give you a better support to your back, or if you had a cesarean delivery, to kind of support the back. But that's about all that they do. They don't help with reducing the pregnancy belly post the delivery. So the only way to get the muscles tensed up or bring the elasticity back to the muscles is to do exercise. So there's no easy way out. You
Okay.
have to do exercise, and you have to do them consistently, because they are muscles like any other muscles in your body. You have to keep, if you have to keep them toned and tensed, you have to exercise. So that is the only solution for this problem.
Okay. So, are there any do's and don'ts in your daily life that so that you don't worsen the damage that you already have? Can you? I
Yeah.
mean, from your experience.
So basically, right, every single activity that we do is actually supported by the core muscles. Even the simple act of standing up or lying down or sitting or carrying, every single action is supported by the core muscles. So when the core muscles are already weak, when you try to do these activities in an improper way, what happens is that there's an additional strain on these core muscles, and this would lead to it being damaged more or losing its elasticity even more. So, what is required is doing the activities such that there's less strain on the core muscles. So, a simple way of doing is like, for example, if you're lying down on the bed, when you're getting up, you have to always turn to the sides and then come up. You shouldn't come up
Okay.
straight away. Or for example, if you're going to lift any object, you have to engage your core and then lift the object. And also the most important thing is that people are always advised to do crunches or sit-ups to strengthen the core muscles, right? That is the case for people who do not have this problem. But
Okay.
when women have the diastasis recti, the best is you should not be attempting any exercises such as crunches or sit-ups, which will involve lifting of your shoulders and head off the ground, or any exercises that causes doming of your belly when you perform that action. So you
Oh.
have to always be aware of the fact that there is no doming happening in your abdomen area when you do your exercises or your day-to-day activities. You can just like, when you're doing your activity, you can just have a look down to see whether there's doming happening when you're doing it. If it's happening, then it means that you have to change the way that you do it.
Okay. Okay, that's such important information for people to know. So, lastly, do you have any preventive measures that you can suggest for our viewers? Because it's such important wellness issue, like it's long-term wellness issue for women. So, if it can be prevented or minimizing the damage, is there anything that you can tell?
The only thing is like, if you haven't got pregnant so far, just try to perform exercises to strengthen your core first before you get pregnant. So that will help tremendously to avoid this condition. But that said, right, if your body is prone to it, nothing can be done. So the only way to address this problem is to do consistent exercise, and that will really help to bring back your flat tummy as before.
Thank you very much, Aish. It was a very insightful interview for us. I hope this will help a lot of women around. Yeah, so thank you.
Thank you very much for giving this opportunity, Aishwarya, as well, because this is an excellent, as I mentioned again, it's an excellent platform to share stuff about, get to know about more about health. And this is really important with regards to women's health, and every mother needs to know this. So thank you very much for giving me this opportunity.